everyone, my name is Jeffrey Wu. I am a GYN surgeon here in Norfolk, Virginia. I am faculty and assistant professor of OBGYN at Eastern Virginia Medical School at Old Dominion University, and I am the creator of MIGS Tips and also currently serve as the AAGL Surgery U Editor-in-Chief. Yeah, so creating the video is always really nice, and whenever I create a video, I'm like always on my phone. I post it within 24 hours. I always want to know the statistics, how many views did it get, how many likes, shares, bookmarks. So that's always really satisfying for me to see a popular video and a less popular video. I kind of have an idea of that even before I put it out. Now that I put out so many videos, I kind of know which one's going to be a hit. I think the bigger impact, though, is when I get these random text messages from colleagues across the nation, or I'm at a conference and be like, "Hey, Jeff, you know that little endo loop that you put around that corneal topic? I did that the other day, and it really helped me when I was in a bind at 2 a.m." And so I think that's the most gratifying thing. It's not just all the likes and the comments and the reposts. I think it kind of shows where the video is going in popularity, but really hearing that kind of direct interaction with other surgeons, that it really did help them in their clinical practice and their surgical practice. I think that's the most gratifying thing about these videos that I make. Sometimes I hear trainees that were on, like, for instance, their GYN oncology rotation, and they would watch my video, right before the surgery, and they got pimped or, questioned about that exact same anatomy later during the day. I think that's really gratifying too, just knowing that the trainees are really benefiting from the surgery. It's kind of interesting too, because I don't market. This is like, none of my videos should make sense to really many patients, but still it trickles down to patients because they'd be like, "Oh, Dr. Wu, I saw your videos, I saw this and that, and now I kind of understand what this robotic approach is because I watched your videos." So it's, even though it's wasn't my direct target market, it's kind of trickled out to patients as well. My videos have also been used, I guess, as training tools for industry as well. So some companies have been like, "Hey, you use that device really with a lot of finesse. Can we actually use that in our training videos?" So that's really connected me with some particular GYN industry outlets as well. So it all started when I was an intern, actually, as a resident. I went to AAGL for the first time, which is the American Association of Gynecological Laparoscopists. It was a convention center in Orlando, and I went there, and I was just amazed by all the surgical videos I was seeing. Surgical videography has always been a big part of AAGL, and so I was just found out I was learning so much from the videos. So I came back naturally to my residency, and I wanted to record everything. I was inspired. And I started sending these videos that I would just kind of amateurly and, on my movie edit, and I started sending them to regional conferences. And that's when I started winning awards. Then I eventually was accepted as a fellow and started fellowship. And without obstetrics, I had so much more surgery, so much more video content, so much time. And so I started really producing a lot of videos. And that's when I started sending them to my peers and friends. And they said, "Wow, you should create a social media account. Don't just keep them to us. You can create them and show them to everyone." And that's what kind of motivated me to start MIGS Tips. Actually just 6 months into my first year of fellowship, and ever since then it's kind of exploded. So I think the biggest hurdle is that, well, number one, you aren't going to be natural at making editing videos. It takes a lot of time, and just like everything we do in medicine or even outside of medicine, it's kind of an artwork, and it takes practice and time. So your first time you edit a video, it's going to be horrendous. It's going to take 12 hours. You need to learn all the different hotkeys and all the buttons on your iMovie. But as you do more, you're going to get better and better, and your videos will show it. It'll look better and better. So that's one thing. Be patient and just know it's going to take time and practice. I think another thing, so once you have your videos, I think another big hurdle to start social media and to start posting videos is just fear. I think we all are self-conscious of what others will think of us, posting videos. Oh, do they think I'm a better surgeon than these other people? Is this the only way you can do it? But in reality, I think, just posting videos out there, I think people will appreciate the attempt, the trying, the hard work that you put in to create a video. And I think people will respect that. And I think just kind of, I think there'll always be, naysayers or people that, have comments or trolls on the internet, but just kind of brushing those aside and knowing that just kind of reinforcing why you're doing this and why, you want to educate others or educate patients. It should be the motivating force behind our creation and our work.